Hello, good evening. How are you? How are you doing? How you day? Welcome to another session of Ask the Doctors. Ask the Doctors na health program where they hold every Sunday by 8 p.m. Nigerian time, a 1 hour program. Now, this program we dey here to teach, to explain to you, and explain many things where you don't understand. On this program, we not they treat anybody. We not they share medicines to cure you here. Here na to just explain, make you understand. My name na Dr. Frederick Unubohai. People call me Dr. Fredostar. And if you don't hear the word good life na sense, now maybe that. Welcome. I be the host of this program, and my co-host na Dr. Israel Irobonose. Himself they day with me on the program. We don't they do this program for more than 4 years now. So today we want to talk about something very interesting. Today's program now on topic, and today's program now on steroid abuse. Steroid. A lot of people they abuse steroid. Now we decide, say, make we talk about steroid today, so that make you understand, make you know, and make you know use your hand by yourself. That is why we have decided to talk about steroid abuse today. Before I continue, tell me where you dey watch me from. Oh yeah, put it in the comment section. Where are you watching me from? Let's go. Yes, and share this video. In your bong SN. Good evening. How are you? Good evening. Watching from France. Oshe. Now so. How is France? Talk to me. Who else again? They here. Let's talk about steroid abuse tonight. Hmm? Uh-huh. Hmm? Okay. This my camera. It will go up, but no problem. Go Desha. Hmm? So this my camera. But we're good, yes. So we dey talk about steroid abuse today because a lot of people don't they abuse steroid. And somebody says, I'm watching you from Benin City. Oh yeah now. Good evening. Theodora. Good evening. Watching from Scotland. Oshe. Very good. Watching from Ogun State. I see you. Now, if you dey watch this video and we don't end, sorry, we no go fit answer you. But right now, I dey live and the time is 8:03 p.m. in Nigeria. Wetin you understand by the word steroid? You don't hear about steroid before? If you don't hear about steroid, put them in the comment section. Tell me. Oh yeah, let's go. Tell me. Wetin you don't understand by the word steroid? When you hear steroid, wetin they enter your mind? Oh baby, my guy, explain to me. Let's go. So I dey look my screen, my camera they give me some kind of problem, the settings. So is well. What do you understand by the word steroid? If you don't hear steroid before, oh yeah, put them in the comment section. Tell me, what do you understand by that word? Oh yeah, I dey wait because after today you must understand wetin steroid be. Somebody on YouTube says, I've not heard about it before. Oh yeah, nah. You've not heard about steroid before. Good. Today you go understand. Igwe, how are you? Oh yeah, now answer me. Oh baby, what do you understand by the word steroid? If you never hear, tell me say I never hear. Oh, I don't know what it means. Oh, I don't hear about steroid before, but one or two things. See. But yeah, now explain to me. Talk to me. I dey wait. I'm waiting. Oh, if you no answer me, I no go move. Oh, hey, these people. I think it's a disease. No. Mr. Chudon. No. Okay, somebody on YouTube, Joshua, says, I never hear. No problem. Today you go learn. I'm waiting for you. Harriet on YouTube. My people on YouTube. Nice. Share this video. Click on the like. Let more people come and watch us. Oh yeah, I'm waiting for you. Wait, no time now. Why you they do me like this? Eh? Why you they do me like this? Why they do me like this? Tell me, what do you understand by the word? Okay, so let's start. Number one, steroid. Listen carefully. Steroid na things wey dey inside your body wey be like chemical, to make your body function well. Every human being get steroid for im body normal. If you no get steroid, your body no go function well. So as your blood dey for your body, as your heart dey function, as everything dey function, steroid as well, e also dey inside your body wey dey make your body function. And one very popular thing wey steroid be like hormone. Dr. Israel don come. Steroid, e be like hormone. Dr. Israel is in the house. Dr. Israel, if you are ready, give me thumbs up. I'll bring you up. Okay.
No.
Yeah, Dr. Israel, how you doing?
I'm doing fine. Good evening. Happy Sunday to you
Yes.
and to everybody who will join us today.
Yes. Welcome so much, Dr. Israel. And for the people who just watch for the first time, you dey welcome. Me and Dr. Israel, now we dey run this program since. And today we dey talk about steroid abuse. I don't talk, say steroid. Everybody, your body needs steroid to function. If you no get steroid, your body no go function well. Steroid majorly na like hormone where your body they take function. Every human being like hormone. So when you dey hear hormone, most times all those hormones inside the body, na like steroid dem be. You dey follow me, and your body they produce them normally for you to function. So if your body no produce am well, problem fit happen. If your body produce am too much past how you need am, problem go dey. That is why everything must arrange themselves, balance together. Dr. Israel, oh yeah, now go ahead. Make I allow you give small introduction.
Okay. Steroid. We get what they call the one when we take the tablet from the medicine, and what they call corticosteroid or steroid, and we get the one when they produce from body, and the one when they produce from body, they call on the cortisol. Cortisol. So the body they produce cortisol, and now one organ and they produce, and now steroid now hormone, and now be cortisol hormone when they when the one of the organ when they call adrenal gland they
Adrenal
produce
gland, yes.
this gland. Yes, this gland they on top our kidney. Now there the gland they. So they produce this hormone, and this hormone now this other name now they call stress hormone, because they help us they fight against stress. That's one of the major function when they do. Yeah. So if as Dr. Fred talked, if you produce her in a little form, no problem. If you produce her, if the body produce her over, no problem. However, there are some times, and this steroid when we want to talk about for today, we're going to talk about the exogenous steroid. That is the one when we they take into our body. Yes, we go see mention the endogenous steroid. That is the one when the body they produce. We will mention all of them together. So most likely the one we really then concerned about, and the one when we they take enter our body, and when we they call steroid, and then they come in different form. They come in a tablet form, they come in injection form, they come in inhalational form. That is the one when they inhale through the nose. Even they come as some they come as eye drop as well. So these ones, what did they do? They see they help the safe function when the cortisol they do. So that when the cortisol not do many of it, they go just help. They will just help add to the one when our inner body they produce, they do. Nine be the nine that they do. But sometimes some of us they can't abuse them. Some of us they can't use them more than as we suppose use them. So now there, now the problem can't lie. And are those ones now we want to talk about today. So that you go know the importance of steroid, why sometimes doctor they prescribe steroid, and also for you to know, say this steroid when they prescribe, you're not supposed to take them for a very long time. And if you because you get condition where go make you take them for a long time, your doctor still know how you go sit tell you make you use them, and how you go take use and make you not get a problem. Dr. Fred.
Yes, thank you so much, Dr. Israel. Now, we don't tell you wetin steroid be. E plenty. We wan talk about the one wey people dey drink. But before we talk about that one, we let you know say normally we dey use steroid for hospital. We dey give patients. Patients dey like people wey get allergies, people wey get asthma, people wey get like some kind problem with immune system and many things we dey give them. We dey prescribe am. And when doctor prescribe steroid for you, e go tell you say, take am for 1 day, take am for 3 days, take am for 5 days, take am for 2 weeks, and make you stop. But the problem be say our people go come go dey take am pass normal. Sometimes they will go dey buy am on their own because somebody don lie to them, tell them say, this steroid dey go do this for your body, you come dey drink am, not knowing say problem dey wait for the person for front. So na those problems, na we wan list. But remember, steroid na good medicine. E dey save life well well. E just be like that thing wey dey shoot kpishon kpishon. If you get some like thief attack you now, you fit use kpishon kpishon, e go help you. But if you can't go give pikin kpishon kpishon, pikin fit use am scatter the whole house. So if you carry steroid put for your hand wey you no know wetin e be, just dey drink am, gbege fit enter and you can suffer well well. If you just dey come, abeg, share this live video, share am, invite your friends, make dem come learn, so that make dem no use your hand scatter their body. This program na to teach you. Dr. Israel, so make we start. First of all, wetin be the reason wey make people dey abuse steroid? Because even after we go beg them today, even after we don beg you, make you no abuse, some people go still go continue to abuse am. So wetin be those reasons why be say our people sabi abuse steroid well well?
Okay, as I dey talk, the reason why some persons dey abuse steroid, you go still notice say some of the thing when I go talk go be the normal thing when you suppose use steroid for. Just that when you overuse am, it becomes a problem as we talk. Now, some medical condition dey when you suppose use steroid for, and some people when get those medical conditions, some of them dey abuse the steroid. And some of the condition, as we talk, asthma, people wey get asthma, sometimes they may be giving steroid. Now, wetin this steroid dey do? Before we even talk as people dey abuse am, make we just because e good make all of us dey the same page. And not good to say na only the bad thing we want you talk. No, most still talk the good thing when this steroid still they do small before we can talk some other things. Now, as I first talk, I said steroid now one hormone what they call stress hormone. That is, they help reduce stress. When the body they are stress, if the person, the body go also by itself produce those steroid, those cortisol by the adrenal gland. Then it will help to reduce those stress. So that na one. Two, when we take steroid, it help to fight some allergic reactions. So when we get allergic reactions, steroid can actually help to reduce those our white blood cells, those our immune system when they over exaggerate, they over fight. Steroid will help calm them down to some extent. And another one is that steroid they help to reduce swelling, redness, inflammation. And when we talk about inflammation and the body responds to infection and all that, and pain. So steroid will still help to reduce them. So people when they get arthritis, rheumatoid arthritis, lupus, and all that, yes, asthma, because all those things are allergic. Some of them are allergic reaction, and some of them are immune problems. So steroid they good for these people. However, when some people when they know say steroid they good, some of them will come to over they use the steroid, so it can become abuse in that aspect. So that is one way when people take they abuse steroid. So as I talk, medical condition, people will get some medical condition when they need steroid, there's sometimes they over use them. Two, so people believe say with steroid they go fat, say they go add weight, they'll come big. So that one, most people will come to use steroid in that condition to make sure say they're fat. Some people also believe say if they use steroid for their cream and all that, it will make their skin they white. It will make their skin come be like omomo skin, they soft. And they go they white as well. So those are now some of the reasons why people they abuse steroid. Also, the thing say if they use steroid, their skin will also be fresh as well. So these are not for some. These are not some of the reasons why they abuse steroid. However, because you get athletic people where they abuse steroid, their own type of steroid different from this steroid when we they talk about now. Because this one when they talk about are the common ones when we they see around now we they talk about for today.
Mm,
Dr. Fred.
mm. Yes, thank you so much, Dr. Israel. Our people, one thing where I don't notice be say people go come here, we go teach them, they no go share, they no go invite their friends. But if now other topics, you go see them they share. This topic go save people life, go save even your friend, your family members. Share this live session, make them come watch. Okay, oh now Dr. Israel mentioned something where they very important. He talk say some people go take steroid because they won't add weight. They go tell them say, madam, oh, you want fat, abi? Go drink this medicine, it go make you fat. They sell am well, well. If you enter all those e-commerce online, you go see them where they sell am. If you enter Instagrams, you go see am. If you enter Facebook, you go see am. Even TikTok, people don't they sell am, and they kill our people small, small. Now another thing where people they use steroid for, where they very wrong. They go tell you say, if you they get pain for your body, say make you dey drink steroid, say e go make your pain go, not knowing that the function of the steroid to remove pain for your body na just in the immediate, no be something wey you suppose to dey take continuous. When you come dey take am, dey take am, dey take am, dey take am, dey go, problem problem go surely visit that person. So we wan start to list some of the problems. Before we continue, steroid is very good when doctor prescribe am for you, when you follow the advice. But if you can't dey take am for other things wey doctor no prescribe am for you, walai talai, problem go visit that person. The first thing wey fit happen to that patient be say e fit increase the person blood pressure, e fit affect the heart. You know, people go tell you say, I no get any problem or nobody for my family get high blood pressure and the rest. But when they come, they take steroid because the way steroid they function, the one way they drink, they drink them, will come make your body they gather some kind things where your body no need. Those things go come they push your BP up, your blood pressure go come they go up, small, 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 small. It don't they spoil your heart. Small, 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 small. The heart go scatter and fail. Go just scatter. So make I hand over to Dr. Israel again, so that make we come they list some of the things wey go happen to people wey dey take steroid when doctor no prescribe am for them. Dr. Israel, over to you.
Okay, now when you don't overtake steroid, many issues fit happen, and as Dr. Fred talk, one of them high blood pressure. Now remember, say we say steroid they help to reduce, they try to reduce the white blood cell, the immune system. They try to reduce their function so that make them not dey over exaggerate. So for you when not even get those immune system when they exaggerate, you can still go they take steroid. You they calm people when don't feel calm, you they make them calm well. To the extent say another problem you can't be say you go they could they get infection. Disease state go fit they enter your body, infection go fit they catch people when they take steroid. Another thing is that their skin go they thin, so bruises they go they feel quick they injured, and they go they injure their body on time. Another thing is that their bone go come they weak, come they lead to osteoporosis, and now they call weakness of bone. And some of them go come they get insomnia, they not go feel they sleep well, and they'll come they irritated. Eh? Insomnia means say they not they sleep for night. So some of them go they irritated and all that. Now, if this person can they take this steroid, don't take am for a long time, it will come lead to one condition one they call Cushing syndrome. When they call Cushing syndrome, that one get a lot of signs and symptoms. In fact, every side event when we go talk inside that Cushing syndrome, now all of them dey. And inside that Cushing syndrome, now they dey. So if we want to take that one, we fit take for the man, we fit take for the woman, we can't take for general. If you take affect person. One another thing when too much steroid they cause wound healing, slow wound healing, so that if you injure your body and you want make it heal, the thing no go heal on time. It go dey there. for a very long time. And go dey there for a very long time. Now, for people wey get Cushing syndrome, they get their own way how they look. One of the things when you go see for them, they'll get round face, when they call moon face. And their face go round. You'll be like, say their face, they make pupu, they sweat. Then they get what they call buffalo hump for back. You know all this buffalo, if you know buffalo, you know, say they get one big hunch, like hunchback. So some people go come get that kind of thing. And accumulation of fat, fat when the body will come go gather for there, what they call them buffalo hump. Some of them will come get truncal obesity, their belly will come big well. You can't be like say that they chop life, whereas not be life that they chop. Their hands and leg fit dey very slim, and their muscles go dey weak, their skin go dey thin, so they go fit dey easily bruise. Another thing when you go notice for their skin, they go get stretch mark, and this stretch mark go dey either pink or purple stretch mark. And this stretch mark make on the place where you fit find them for, you fit see them for their breast, for their where their bobby dey, you fit see them for under their armpits, you fit see them for their buttocks and all those places. These are some place where you fit see this stretch mark. Now for women, their period, they no go dey see am well. Some no go even see their period again, while some their period go come dey irregular. While for men, some of them no go come get urge say they want knack. While some infertility go come dey. When we say infertility, no go fit make woman get belle. Also, they go come dey even dey get ED, when we dey call erectile dysfunction. Some of them go even get erectile dysfunction. Now, some of them, their skin go dey their skin go dey very dark, mostly for the women. They go come dey grow hair. What do you call them again? Exutism. And they come dey grow hair for every part. Yes, every part of their body. While for these are some of the symptoms when people will they see when they don't they get Cushing, when they don't they get Cushing syndrome. And these are not due to because this person don't they take steroid for a very long time. Their body don't get a lot of steroid. Now this person physically quick get diabetes, and we'd already talk hypertension. So diabetes could just see the road, and the person will feel quick come down with diabetes. These are some of the signs and symptoms when person fit get. Now, also, if you see affect their mood, they go come their psychological thinking. Some of them will come irritated, they'll come depressed, anxiety go fit even come join, and when they don't overuse this steroid. Okay, Dr. Fred.
Thank you so much, Dr. Israel. You don't mention almost all the complications, all the dangers wey person go see if person dey drink steroid anyhow. One very important one, now that one wey person go dey swell up, the face go round, the belle go dey swell up. Now that one they make our ladies they go buy am dey drink. Example of those things where they drink, your D, your KB, they call them mawu mawu. You go drink all those things. When you drink them, people go come tell you say they fat, not knowing that you don't they gather water, and now the complication of the medicine, and they make you the fat. Now make we make am clear to you. This complication we will mention, you might be lucky, you know, go see all of them, but one must touch you if you continue to the abuse am. Some people can be very unlucky, more than 5 go knock them, the complication go visit them. So if you are taking steroid on your own because you like them, they make you feel good, just know, say the problem they front and it go visit you. Now, somebody make a comment here. He says, anyone can access and purchase drugs in Nigeria. Anyone can order any quantity, which is very alarming. Very true. This country, Nigeria, and some other African countries, we need to wake up. Somebody go just wake up, go pharmacy, make una give me 5 fluorouracil, no prescription. Go pharmacy, we just ask for methotrexate and many things, and you go collect because we no get regulation. So the country, we have a long way to go. But that's one, not be our job. What we go do now to teach you and beg you, make you no drink medicine anyhow. If you don't understand, I beg, put them in the comment section and share this video. make more people come learn. Now, somebody don't they drink this medicine for a long time. Somebody just they drink this medicine for a long time. Hope they for him. You get anything when if you do, I be as you don't start to the drink am, so you don't finish. Well, you will never finish. Small hope day. Tomorrow we'll just talk one or two things. Then you can ask us questions. Eh? When you ask us questions, we go take your questions, we go answer you. So, but Dr. Israel, more will talk briefly. What in person feel do now when somebody don't they abuse steroid? What be the advice? Now make it just stop them like that, or make it seek help. What you go tell them?
Okay, and for person when they abuse steroid, when don't they take this steroid for a very long time, one thing, one of the treatment for Cushing syndrome or for side effects is to stop the use of steroid. However, you not go your fit stop am like that. You not just because now drug you just stop no, they not dey stop steroid like that. It just there are some drug when they not dey stop like that. And steroid now part of those drugs when you cannot just stop like that because say na medicine, not because not be anti-malaria. When you just take 3 days, you just stop. Now, the reason is because remember, say we thought say the body now they produce this hormone, what we call cortisol, and this steroid now the same work now they do. So because you don't they take this steroid, they take that organ when supposed to produce cortisol go stop to the produce because the body already get a lot of cortisol. So that organ go your relax, you go to sleep. And you just go to sleep because you notice say no work make I dey do. I don't produce many for everywhere. You dey get am? And even the one wey dey brain, when they produce the one wey we dey call ACTH, adrenocorticotropic hormone, that one na dey go tell the kidney say the one wey dey on top kidney, the adrenal gland wey dey on top kidney say produce cortisol. That one go still go to sleep because that one go don tell don talk say abeg not produce hormone again o. Hormone too full, cortisol too full your body, not produce again. So if you just can go stop am once, all those ones never wake up from sleep. So it go lead to another problem when we dey call steroid withdrawal. So that make you no need to just stop steroid once. You must seek help. You have to go to the hospital. And when you reach hospital, the doctor will take you through a process of stopping that steroid. It will take you of how you take a gradual process. They take a gradual process. They reduce the dose small until you can finally stop am. The process of you reducing all those doses, you dey make the brain and the other organ to dey wake up to say, oh, steroid don dey finish, more produce, steroid don dey finish, so that when you don stop and finish, the work of steroid no go don because we talk say cortisol dey good for body, but just that because when you don over many, nothing for this life, too much of everything for this life is bad. So everything is supposed to be in a moderate form. So when you don overtake am, na it dey cause that problem. And if you can't stop am once, it goes drop once and another problem. So you go to hospital, your doctor will speak with you, go follow you talk, go help you see how you take stop the medication over time, and then they go treat every other symptoms and every other things when it don't happen based on the too much steroid when they your body. Now, another thing when you need to know is that once you stop, maybe they take steroid, they take them by yourself, you can't just stop at once, it will still give you some symptoms. And one of the symptoms when it will give you weakness, but you're tired, fatigue, and you're tired. Sometimes you're irritated. Another one is that yes, you will see they prone to infection and all that because you not allow the body know what it is supposed to do. Dr. Fred.
Thank you so much, Dr. Israel. If you just they come, you they welcome. Today we dey talk about steroid abuse. Our people they drink this medicine anyhow, and this medicine go spoil their life. Now make we carry this matter come talk to you so that you go understand. And if you get papa, mama, auntie, uncle, brother, sister, wife, husband, pikin, neighbor, colleague, where they drink this thing anyhow, Call them, warn them. We they give you this free information so that make you not suffer and go spend money. So call and warn them. But one very important thing where Dr. Israel don't talk, they say, if you they drink steroid, you don't they drink them because you want fat, they drink, they go, or for whatever reason, where no be doctor advise you. No stop them on your own, no. No just wake up, say I know they do again. If you stop them like that, you go collect severe problems. That is why you go need to speak with your doctor so that may them help you gradually. Check whether the thing don't they give your body small problems. Look for how to help you handle the problem and come out and small for your body. Some women, elderly people, elderly men and women, that they drink and well, say that they get body pain, they drink them, not knowing that this thing go destroy other parts of their body. One very important one we Dr. Israel talk about now hormonal imbalance. It goes scatter your period, madam, or as a man, it goes scatter your gbola area, can affect you to perform, can affect you to give your woman belly, can affect woman to see period, and many other things. So we are taking our time to beg you to make you stop out. But if you continue and problem can happen, wallahi, you go spend plenty money for hospital. Now, if you get question for us on this topic, if you get question for us on this steroid, where we don't talk about, they drop them in the comment section. Make we try answer you. But if you drop question when no they related to the topic, we no go answer you. We no go take your question. No. But if now on the thing where we don't talk tonight, you ask us, yes, by the grace of God, we go respond to you in the shortest time. Don't forget, share this video. Make other people, make other people come learn. Quick. So if you get question on this steroid now, oh yeah, we are waiting. People on YouTube. Yes, I see you. Yes, una plenty. Job question. Hmm?
FAINC.
People on you on Facebook. Oh yeah, drop now. Maybe say when we don't finish, you can't they ask. Remember, eh? Remember, you cannot be taking your D. You cannot be taking your KB. You cannot be taking what they call mawu or all those things because you want to fat. My dear, you will buy. You will definitely buy yourself. So we don't want you to buy. That is why we are doing this thing. Okay, Vivian is asking a question. Is steroids in collagen, please? This is a very excellent question. So make I answer you first of all. Collagen na normal thing where your body they produce to help your skin. Collagen, if you injure yourself and your body won't heal your wound, your body will also produce collagen to help you. So steroid no dey inside collagen like that. You know, your body go need normal go arrange am. But if you dey buy collagen to drink supplements, you get one supplement company, me and them we dey discuss. Make I see whether we go fit do small partnership so that I can explain to you, oh, this supplement is good for you, this one than this one. So you are properly guided. Me and them still they talk. If we finish our discussion, you go see them for my page, no worry. But we are still having some discussion. There should be no steroid in collagen. I don't know how they produce that collagen. Sure you get, I don't know, but there should be no. That is why if you are taking anything, you should be careful. Check, look inside. Waiting there. Do I need it or I don't need it? Why am I taking it? These are the important questions you are supposed to be asking. Not just because I see them. Don't run, go buy and drink. I hear say. No, careful. Sure you clear, Abi? Very good. Okay, if you get question, please drop your question. Drop your question. Yes. Let's see. No forget, share this video. Share the live session. It clear. Very good. Make people come learn. Okay. Dr. Israel, they are not asking us question. Let me see. There's a question here. Somebody says, you are a blessing to this generation. This will help those who are keen on getting fat by fire and by force. Okay. Loretta or Diase, I'm not going to take your question. Your question is taking us out of the topic. Yeah? Your question is taking us out of the topic. No verse. But your question is about collagen. No, we are not talking about collagen. Make we leave them. I beg, I beg. Eh? Please. I don't want to enter that area. If we get time, we go enter that part. But for now, just leave it like that. Just follow the first explanation where I give. Hmm? Yes, let's see. Okay, we are talking about steroid. Dr. Israel, you get anything where you go would like to add again before questions start to drop in? You get one where I would like talk. After I talk my own, then Dr. Israel can talk his own. I beg, no go chemist, no go pharmacy, and tell them, may them give you prednisolone, may them give you predicure, may them give you dexamethasone. Say you want drink, no go buy them on your own if doctor no prescribe them for you. No go chemist, no go pharmacy and buy dexamethasone or cortisone or prednisolone if doctor no prescribe am for you. I dey get body pain, na im make I dey drink am. Did your doctor prescribe it for you, or baby? Oga sir, who give you? Who prescribe am for you? Okay, Israel, you get anything wey you go like add?
Okay, I go want talk based on wetin one of our viewers say when talk say sadly this drug say that they see am buy anywhere for Nigeria, which is really a sad thing. We not suppose they see am buy anyhow for Nigeria. Yes, they get the type when you can buy from any pharmacy without prescription. Then you also get the type when be say you must need prescription to get them. Some of the nose spray and the cream, some of them you can see it without prescription. But the tablet, the injection type, you suppose get a prescription before you get them. And also we use this medium to say, okay, make we still tell you say e no make sense say you go just go chemist or go pharmacy, just go dey buy all this medication because you hear say person wey dey your house get one symptom wey look like wetin you get, and e dey take one of those corticosteroid medication, make you come still go take am for treatment. No be so, e dey work. You suppose go hospital and let your doctor talk to you. Now, as we don talk all these things, e look simple. Say all these things. Shey when I stop the drug, everything will go back to normal. However, sometimes you may not be lucky enough
Mm.
to stop the medication for the things to go back to normal. You may even stop the medication and nothing will go back to normal. Your body does spoil, it does spoil.
True,
So that
true.
are some of the things where you need to know. Now, when we talk about Cushing syndrome, we only talk about the medication, the overdose, you taking too much of the exogenous type, exogenous and cortisol, when it cause am. Other things still dey when fit cause Cushing syndrome, or if the body decide to produce too much of the cortisol, it fit still cause Cushing syndrome. But we not talk about that because before you reach to that, na hospital na go always take care of that. Cancers and all that fit cause that. But we are all concerned about the one when you dey go collect, the one when you dey by yourself do, when go fit cause problem for you. And you see say even you want will stop am, na still problem. So why you go start something wey be
Mm-hmm.
say to stop na problem? To start, if you start, e go give you problem for future. If you wan stop am, na problem. You no go just stop am once until you come see take am for some time before you fit stop am. Why not just stay away from it, except your doctor na prescribe am for you, make you take am. And most of the time when doctor prescribe am for you, they prescribe am for you for a short period of time, make you take am.
Mm.
Even for those wey need am for continuously, e still get the dose wey you go fit give them. When we dey give them, e still get the way wey we go say make dem take am, when go be say dem fit take am continuously. Dr. Fred.
Mm. Thank you, Dr. Israel. Before I continue again, if you want to sponsor this program, you are free to sponsor. Send an email the email there for the page. You go see the link there. The email. Send email. Say I want to sponsor or want to run an advert. Yes, we don't reach that level. We say we go do advert for you. You go gain value. So send the email. Now somebody they ask us question. Maybe this person come late. This person no listen to what we they talk, or maybe she came late. He said, He said, does steroid affect the body organs? Please. Yeah. Listen, make I just talk one thing.
Okay.
Normally, steroid good. We dey use steroid help patients. We dey use steroid treat many complaints wey patient get. We dey prescribe am, and when we prescribe am, we go warn the patient say take am like this, like this. We go warn because if you go take am pass normal, problem can happen, and the problem can affect every part of your body. Can affect your eye. You feel blind, you no go see. You go develop cataracts. Like you no go see again after a long while. Can affect your brain. You go develop stroke, go connect to your heart, go spoil your heart, go spoil your kidney, go spoil your bone, go destroy your immune system. Your immune system go down, go weak, you go get immunosuppression. You can't develop infection every time. Your skin go be like paper, go dey develop severe stretch mark. If you wound, your wound no go heal. You go dey get wound, your wound go tey for your body. If you carry your blood sugar, go give you diabetes, go scatter your bone, go scatter your period, go scatter your blockers. If you take am how doctor no prescribe am for you, na make us dey beg because our people dey suffer well well. Na make us dey beg now so that you go hear. But if you can't continue, okay, please, Dr. Israel, is steroid a blood syrup?
No. Steroid not be blood syrup, not be blood syrup. Steroid supposed to be their hormone, like their hormone when the body they produce. But however, we still get the form for as tablets when some of us sometimes we they prescribe for patient, and sometimes some people they by themselves go take am. It dey the form of drug, form of cream, form of inhaler, and even eye drop. Some steroid dey in that form. So it not be blood tonic, not be blood syrup at all. Now medicine of its own when people feel use. Just as the body can also produce the cortisol to do all the normal function. Now, another problem when steroid fit give us, if it cause weight gain, it will come make the person turn to obesity, obese. And this is because of the many fluid wey don gather for the person body, the truncal obesity, the buffalo horn and all that. When the person check him weight, you can't dey overweight. And so you need to know that. And when you don't get overweight, you know, say person when fat big, when fat, when be obese, hypertension na go fit catch that person. Diabetes go fit follow that person as well. And so many other things go come dey follow the person.
Okay, thank you. I notice our people know they share this video, they know they share the live session, they look us, no problem. We they do the one with our mind. But if God forbid something can happen, you can't say, doctors are wicked, nurses are not working, this and that. You know, say you are a liar. Or to help our people, help us share this video. Somebody is asking Dr. Israel, Adeluba Iyabo de Comfort, what will happen if someone stops it at once? Wetin go do the person? Hey. Dr. Israel.
Okay, and it not good make you stop steroid at once. Mostly for those wey don dey take am for a very long time. Not be for people wey just take am for a few days. Not be for those prescription when doctor give you say for 2 days, for 3 days, or for 5 days. We don't dey talk about those ones. But if you don't dey take am for a very long time, in fact, you are dwelling inside steroid. Now inside there you for the bath. Now inside there you just dey. Now those kind of persons now no go fit stop am at once. One, if they stop am at once, remember I try to explain the reason. Because steroid the cortisol don't too full their body, that hormone when the drug they bring out from the body don't too full their body. All those organs when they supposed produce those hormone go sleep. So they not go produce them. So once you stop am at once and the level of that cortisol drop at once, those organ never wake up from sleep. So because they never wake up from sleep, you go actually get so many problems wey go happen. And one of them na severe weakness of the body. There's severe fatigue. Another one na body pains, bone pains, irritation. You dey irritability, that is you dey irritated. You just dey irritated. Any small thing dey vex you. So those are na some of the few things wey fit happen to the person. There many, but these are na just some few ones when I fit just remember now when fit happen to the
You,
persons.
yeah. If you also notice,
So and
say
if
the
this
person will come. Okay, go ahead. Go ahead.
no continue.
Another one be say if you notice say the person fit come dey dark, go come black. You know, go in color go come change because you don't suddenly stop, or you go come lose weight well well. If you lose weight like drastically, sometimes person go tell you say salt come dey hungry am too much. Salt dey hungry am. All these things na wetin Dr. Israel explain. Your body needs steroid to function, but because you no give am again, and the normal one wey your body dey produce, your body don stop because you dey drink. As you stop am like this, disaster. So wetin you dey try avoid go come. That is why you must, capital letter must, you must discuss with your doctor if you don dey drink steroid for a long time, and no be doctor tell you. You must o. Good life na sense. Okay. What will happen to someone before the doctor will prescribe it for the person?
Okay, there are so many things where we dey use when they dey use steroid for. I think we mentioned some at first. So patient wey get asthma, doctor fit give them steroid. We talk say allergic cases, COPD, chronic obstructive pulmonary disease. People wey get that one, the doctor go still fit give them. People wey get rheumatoid arthritis, and when be say fluid go dey gather for their bones and their joints, doctor go fit still give steroid to take reduce all those inflammation. And another thing, wetin dey cause any infection or any problem when dey connected to our immune system, when connected to our immune system, like lupus, the steroid, the doctor fit still give steroid to take reduce the effect of our immune system. You know, say some autoimmune disease wey be say the immune go dey over exaggerate, go just dey over function, dey overdo.
Mm.
So when you give steroid, the steroid go calm am down. Tell am say, guy, calm down, not dey overdo. So some condition dey like that. So person fit still take steroid. Also, if you give person organ transplant, like people when they give kidney, give heart, all those organ transplant, the person still need to dey on steroid, because if you not dey on steroid, the body, those organ when you transplant enter the person body, the person go dey look those, the normal body go dey look that foreign organ as a foreigner, and they go want kill am. But you no want make dem kill am so that the person can function well. So the doctor go still give them steroid so that that organ go fit stay alive. Then there are some skin infections, skin diseases like eczema, that steroid go fit still help. Steroid go fit still help for when you use them. However, all these are what they mention, you need a doctor to prescribe these drugs for you before you go use them for all these conditions. And as I dey talk, not be everybody get asthma, not be everybody get rheumatoid arthritis. In fact, you don't even want to have rheumatoid arthritis in the first place, except you want get am. And not everybody get skin diseases. Not everybody go injure themselves, can't get swelling. All those people when they get swelling, maybe for their joints and some part of their body, maybe because of injury, inflammation, yes, steroid can actually work a little for them. Now, steroid is not like it's going to cure that disease or it's going to cure the cause of the problem. No, what steroid they do is just to reduce the pain, the pressure, the stress, because we call am stress hormone, the stress wey dey happen for that place, na steroid dey help reduce. And so e not actually dey treat the disease, but dey help to reduce the problem wey the disease dey cause for the person.
Thank you so much, Dr. Israel. Every time, every Sunday, we did day here, we did beg our people, we did try to beg our people, no they take medicine anyhow, no they take medicine anyhow. Sometimes our people go talk saying a lie. The only thing way doctors are being as they give medicine. Doctors are begging you now, don't drink medicine, don't drink medicine. Our people know they agree. Only when it is necessary, they will give you medicine. If you don't need them, no touch them, they no go agree. When you can't touch them, the problems with the inside there plenty. I make calls to take our time to explain to you so that you don't enter that area because that area the journey long well. If you get question, you can still ask. Oh, we get 10 more minutes to end the program for today. 10 more minutes. But if you know so you don't learn something tonight, drop them in the comment section. Tell us what you learn. I won't see them. I won't read them. Make I know say true. You learned something tonight. Oh yeah. Put in the comment section. Let's go. Let me see. One greatest problem we they get for the country now say anybody can just wake up and buy any medicine. No prescription. People just buy. Anybody can wake up and open the store, call them chemist, call them pharmacy, and start selling. Um, okay. Dr. Israel, make we try to the round up right now. So we'll just give a brief overview of all the things we will not talk about from the beginning.
Okay. Yeah, that the waiting you read, waiting you talk just now really a big problem for this country. That anybody if you just wake up, carry go buy any medicine for any pharmacy. It's not supposed to be like that normally. Even to antibiotics, you're not supposed to enter pharmacy go buy antibiotics like that. You're not supposed. There must be a prescription before you go fit even go buy it. And if the prescription get as e be, the pharmacy never supposed to sell am for you. E not supposed give you at all.
Mm-hmm.
But our country where we dey now as we see am, everybody dey look for im own daily bread, everybody dey look for im money. So sometimes people are doing what they never supposed to do just to get money. Even hospitals, some hospital does what they never supposed to do just to get money, which is wrong and which is really wrong. That na for another talk of another day. So I'm not going to come dey talk about that one now. If I say we see the day when we go get the opportunity to do doctor gist, maybe we go talk on that. Okay,
Mm.
so so and when we talk about steroid, and we define steroid, say steroid na this hormone what we dey call cortisol when the body they produce on its own, and they produce by the adrenal gland when they on top the kidney. Now they produce cortisol, and cortisol is also a stress hormone. It's also a stress hormone. Now steroid na hormone, and that's what you should know. Now we're gonna get what we they call the exogenous and endogenous steroid. The endogenous steroid that be the one when the body they produce by itself, which we they call cortisol. Now the body they produce that one by itself. When the body notices there is stress, there is problem, it will produce that one. Now we dey get the exogenous steroid, which we dey take as tablet, we dey take as cream when we take dey rub, we dey use as inhaler, some when we take dey inhale for those wey dey get blocked nose on time and all that. And for eye as eye drop as well. Sometimes we dey use steroid. Those are called the exogenous steroid because now we dey take am dey enter our body. So we can see say most of this exogenous steroid, most people they abuse them. And that is why we decide to talk about it today. Now, steroid is a wonderful medication that can be used, and it's used for so many conditions. Condition that is when we talk about allergic conditions and when we talk about autoimmune conditions, steroid they play a good role in their management. Though it not they treat the condition, but they help to reduce all the stress when the condition they bring follow body. Like for asthma, it help to reduce all those allergic white blood cell when the body they produce. You go tell them make they calm down, make the person for fit breathe well. Now, these are just some of the function when steroid they help us they do. But some people could come they abuse them because one they want fat, to the one-time thin skin, and so on and so forth. And some people believe say that if they take a because somebody they take and then one take am, I will constantly notice say even some people when yes doctor actually prescribe am for them, like those people will get asthma, some of them constantly abuse am even when they no need to take am. Now even in asthmatic case, if you know they get symptom of asthma, you know they get symptom of attack, you're not supposed to take am, you're not supposed to take even the asthma drug and all that. But some people just take it because they believe say they suppose take am. So these are when you can't do over, they take am for a long time, they take am, they take am, they take am, they take am, you not gree stop and not be doctor prescribe am for you, you just decide to dey do your own thing. Then if you can't give problem, I will come decide to mention some of the issues when person fit notice when you don dey abuse steroid, when you don dey abuse steroid for a very long time. I will come sum all of them for wetin we dey call Cushing syndrome. Cushing syndrome. Cushing syndrome means say there's a lot of cortisol or a lot of steroid for inside the body, and this can be due to two ways. It can be due to endogenous when the body overproduce, or exogenous when you over swallow, overtake many of the medication. I will come mention some of the symptoms, signs and symptoms when you go see, and this one include from the head go reach down, even your skin. You can get stress mark, thin skin, you fit get osteoporosis, hypertension fit come, diabetes fit come, wound healing go dey reduce, so that is if you injure, your wound no go quick heal. We come still talk about say you fit come get obesity, we get wetin they call buffalo hump when the dey person back and between the shoulder, and the person fit get truncal obesity, that is the belle go come big, im hand and leg go dey thin, overweight go dey there. Sometimes you fit get edema as well, bilateral edema, you fit still get those ones as well. So we continue to talk say even though you don dey take this steroid for a very long time, you no go just fit stop am immediately once. You must see your doctor so that they go carry you through a process of stopping it, so that make you not get wetin we dey call steroid withdrawal syndrome. Withdrawal syndrome. Because if you stop the steroid once, at once, without taking gradual process to stop am, you fit still get problem. And some of the problem wey you fit get severe weakness, body pain, irritation, bone pain, you fit even your skin fit come dey very dark, and so on and so forth. So these ones fit still affect you. However, in all these things wey we dey talk, we still wan tell you say cortisol is very good for the body, but make we not abuse am, so that make e not give us problem. Now when we abuse am, na there problem go dey. And na there problem go dey. Thank you. Dr. Fred.
Yeah, so Dr. Israel, you don't provide a very detailed summary of all the things that we don't talk about. I beg, not allow anybody deceive you, not allow anybody say anything to you online, tell you say this medicine, they look and well. Example of steroids, we mentioned them before, like your dexamethasone, your cortisone, your prednisolone, all these things, they very careful. No use them anyhow, so that you don't go use your own hand, buy things that will give you problem. I'll always tell you, good life now waiting. Good life na sense. I hope you learned something tonight. If you see anybody near you where they drink this thing, wanna beg them, make he see a doctor. He clear, I be no clear. Put them in the comment section. Final word, Dr. Israel.
Okay, final word just to say big thank you to everybody when you take dey join us every Sunday. Today is another Sunday, and we know say next Sunday you go still dey with us from 8 p.m. to 9 p.m. every Sunday on Ask the Doctor. Now, next Sunday we not get topic, and next Sunday is just question and answer segment. That's our question and answer segment. So every question when you get and when they disturb you, bring and come. We go talk about them as we can. The one where we know if we answer, we will still let you know, because we not be author of knowledge. We not be author of knowledge, not be we get all the knowledge. So, but bring all your question, but I beg, not bring question like you want me we treat you, because we not go treat you online. And not bring question of which medication you want me we give you. We not go give you medication online. All we want you to know is to learn something so that even when you meet your doctor and in dey talk, you go already understand wetin your doctor dey tell you, and you go fit understand wetin e really mean by every word when e dey talk. So get ready for our next Sunday segment, question and answer. And I go still use this medium beg you say, if you get any topic wey you think say you want make we talk about, wey you think say you want make we discuss about, you can drop it on the comment section. You can drop it on the comment section. Even after the live session, you can still drop it. Say, oh, doctor, we want make una talk about this particular topic. We will pick those topics and see how important they are, and we will discuss them so that everybody go learn one or two things. And because that na im make us dey here. Thank you so much, all of you.
Thank you very much. Thank you so much. We don't take your presence here for granted at all. As you spend your data on this page, we make sure say you gain value. You learn something. Oh baby, you learn something. My guy, you learn something. And we are very grateful. Don't forget, help us share this live session so that more people go see them. The earlier the better. Thank you, and we'll go see you next week Sunday. Same time here. No come late, oh. No come late. So if you come late, you go miss. Come early, 8 p.m. every Sunday. Uh-huh. Okay, Ngozi, I see your comments. I have seen your comments, and we go talk. We go take note of that. Au revoir. Bye bye. Good life. Good life. Nonsense.
Nonsense.
Okay. He don't end. He don't end.